Welcome back. Now, it's the new year, and we all know our New Year's resolutions is to lose a few pounds. Well, if you've had a hard time getting those few pounds off, it could be because of your thyroid. Now, we have Dr. Andrew Petersen here, and he's from the Holtorf Medical Group. We're so glad to have you, and excited to learn about this, because I think this is something a lot of us don't think about. It could be hormonal. It could be our thyroid.
It is. It's important. It's not as much fun as talking about Jimmy Kimmel, but it's important. And we're talking about it this time of year. I think the mistake that we make is we say, if I eat less and exercise more, I'll lose weight. That's not always true. It is true for some people, but those aren't the people that struggle to lose weight and keep it off. Those patients, I think it's important to realize, are they have an endocrine disorder, they have a metabolic disorder, they have a medical issue that's preventing them from losing weight and keeping it off. Weight's a symptom of something else. And so people focus on their weight, but if they focused on what the cause was, then the weight would improve, as well as lots of other things, their energy level, their libido, their brain function, all of those sorts of things.
How do you know when it's serious enough that it's not just exercise, you're not just overeating, the weight just won't budge? How do you know when you're at the point that you need to go see a doctor and say what's really happening?
Well, I have a lot of patients that come to me, and they have been eating right and they have been exercising and they're not losing weight, or they lose a little and it comes back on. I think if you're doing that and you're not making progress, go see someone, because you need to find out what the underlying cause is. Is it leptin? Is it thyroid? Is it insulin?
Leptin,
is it estrogen?
Different than thyroid?
Oh yeah, leptin is a hormone that's produced in the adipose cells. It goes up when your fat cells say, I'm good, I don't need to store any more fat. It goes up, and so what happens is if your body responds to it, then your metabolism goes up and your appetite goes down. So leptin resistance, I don't think very many people have heard of that. If it's discovered and treated, suddenly you pay attention, and you're putting on a little weight, and your body says, I'm good, I don't need to store any more energy, and so your metabolism goes up and your appetite goes down.
So how is this diagnosed, and then how do you treat it?
Well, it's important to do the right tests and to do enough of them. I think, you go to the doctor and he draws 2 vials of blood and he checks your thyroid, and he comes back and he says, well, you're normal. Well, in America it's normal to be overweight as well. We shouldn't really shoot for normal, we should shoot for optimal. So what's the optimal level of your thyroid, and what are the optimal tests to do? In addition to that, testing all of the right things. I generally draw 20 vials of blood or more to do all of the tests to find out all of the different things. Because if you have a thyroid problem, you also may very well have a testosterone or an estrogen or an insulin problem. The hormones are all connected. One doesn't go up and it's the only one.
And that's what we were talking about earlier. I hear thyroid thrown out more and more. Like,
right.
I have this problem, I have a low sex drive, is it low thyroid?
And does it develop over time? Does it develop as you get older, or does it at any time?
Sure, it's at any time, but stress causes it, and age is a stress. I think something that a lot of women can relate to. You got pregnant and you had your first baby and you lost that weight pretty easily. But the third or the fourth baby, you just can't lose that baby weight. I have a friend, and she'll tell people, I just haven't lost my baby weight. And they say, oh, how old's your baby? He's 10. And they think she's telling a joke, but it's true. Well, she is telling a joke, but it's true. Because of the hormonal imbalance that she still has, she's not losing that baby weight. If we test that and treat that, now she'll go back to her fight.
You joke because
weight.
you're frustrated. You don't know how else to handle
Yeah.
it. You're like, what do I do? Is there an age that you notice this more than other ages?
Sure, it's more noticed in middle-aged women. I don't like that term. It's somehow condescending. But, in your mid-30s,
okay.
And then from there on, you're like, okay, this is what I weigh now. It doesn't have to be what you weigh. Your set point of your weight, you can return it back to what it was when you were in your 20s by treating things like insulin resistance and leptin resistance and thyroid and hormones, growth hormone being too low. There's also yeast infections. If people have yeast infections, they don't really know it. The key symptom of that is that they crave sugar. And so you crave sugar. Sometimes it's frequent sinus infections, but sugar, yeast loves sugar. It loves sugar more than you do. So you eat the sugar, and both you and the yeast get fat. If you treated the yeast, now you can absorb vitamins better, you can absorb minerals better, it's less stress on your adrenals, so your other hormones improve, and so you can lose weight.
Dr. Petersen gives you hope for all those things you've been
Look, if
frustrated
you're trying to
with.
wrap, and I'm like, oh, I want to ask more questions. I love this.
I know, unfortunately, we're out of time, but he can actually answer your questions in the office, too.
Exactly. One last one. Does this help? We all have that PMS time of the year. Does this
Year?
help?
You have it once
sorry,
a
time
year?
of the month. No, no, no. And especially after a baby. Does the hormone therapy help all that too? Your moods and
Oh,
how
absolutely.
you feel.
Absolutely.
That
It's
way.
not just weight. I mean, I think people think about that in January, but it helps your mood tremendously.
I like to tell my husband I have it once a year. He claims it's once a week. I don't know who's right.
Okay, now I'll let you go ahead. Go ahead.
Okay, all right. If you need to contact Dr. Petersen, he is at the Holtorf Medical Group, and that is located in Provo. We'll put all the information on our website, but you can go to holtorfmed.com. Great place to start with any of your questions. Go to cw30.com/dailydish, and we'll link you. Thank you.
Thank you so
being
much
here.
for having me.
Thanks so much. And coming up next, we have a new running blog. This is a perfect place to visit if you ever need running tips or advice. Next.